Well, should hospitals treat COVID patients with Ivermectin, an anti-parasitic drug typically used for livestock? That's a question under debate right now in a Louisiana courtroom. Jade Cunningham reports.
In August, 64-year-old Charlotte Ratley was taken to a Covington hospital seriously sick with COVID-19. She already had a prescription for ivermectin, but hospital staff wouldn't give it to her. On August 20th, Ratley's family filed an emergency order stating every minute of every day the COVID-19 infection advances in Charlotte without the administration of ivermectin, and that potentially great benefits of ivermectin outweigh the slight potential harm. A judge ruled in their favor, mandating the hospital give her the drug or allow her daughter, a licensed physician's assistant, to do it. But Ratley died the next day before receiving it. Now, St. Tammany Health is pushing back, challenging that ruling. They argue their staff exerts tremendous effort to provide quality medical care and the best possible outcomes for patients, including COVID-19 patients. But it's critical to public health and to the health of STHS patients that COVID-19 therapies be adequately studied with clinical trials and evaluated and approved by the FDA for the treatment of COVID-19. The report also states Ratley's counsel didn't tell the court the ivermectin prescribed to Ratley was done by a pediatric specialist, and they worry the emergency ruling will inspire others to take legal action to force hospitals into giving unapproved drugs. Ivermectin hasn't been federally approved to treat COVID, and while a human version of the drug is used to treat skin conditions, it's commonly used in animals to treat skin and internal parasites. But some argue it's been helpful for some COVID patients. We spoke with emergency medicine physician Dr. Paul Harch in August, who sees the drug as a positive.
I see overwhelming evidence that it can affect patients in a beneficial way in their outcome.
We also spoke with Ochsner infectious disease physician Dr. Sandy Kemmerly and Tulane critical care Dr. Josh Denson in August, who both disagree.
A number of studies, which has been recently peer-reviewed and published, show there's absolutely no data to support its use to treat COVID.
I was talking to someone who was prescribed ivermectin in another state and now is in the ICU on a ventilator. I would not recommend it for me, myself, or my family.
Either way, St. Tammany Health hopes the initial court order will be nullified. That, though, is now up to a judge to decide. Jade Cunningham, Eyewitness News.
We reached out to the St. Tammany Health System for comment. They said they cannot speak on pending litigation. We also reached out to the Ratley's family attorney, who did not respond.